Okay, good evening, guys. Today I'll tell you about some standard operative procedures which are used in ART. Okay, so we all know that to form an embryo, we need sperm, we need ovum, then we'll fuse this and we'll get an embryo, right? So, first we'll know how to select sperms and semen and how to pick up the ovum, then how to transfer the embryo to the uterus. So first we in this video we learn about sperm and all. Okay. So first introduction is see in a semen sample, only 5% of volume is sperm. Remaining everything is liquid only, which is produced by prostate gland and seminal vesicles. Okay, and the first part of ejaculate has the highest concentration of sperm, so it is better to give initially from the early part of ejaculation only. It is better to give for semen analysis. Okay, coming to semen analysis, so once we all know semen analysis should be done in the lab. It is done after masturbation. No lubricant should be used because it will kill sperms. 2 to 5 days abstinence is required. Patient should take a sterile container for semen collection and masturbation only. uh, Condoms and lubricants can kill the sperm. If the male partner says that this withdrawal method, I want to do for withdrawal method, then it is not acceptable as female cells are also will be present in case of withdrawal method, which give false result. Okay, once the semen sample has been collected, it should be delivered to the lab as soon as possible, and in the lab that it is placed in the laminar airflow or on the warm stage. Okay, so how to collect semen collection? One is masturbation, electroejaculation, vibrator therapy, surgical methods like testicular sperm aspiration from testis they directly aspirate. Then microsurgical PESA, microsurgical epididymal. We know the epididymis, right? The epididymis, this one. Okay. From that we'll remove the sperm. Okay. So microsurgical epididymal sperm aspiration, percutaneous epididymal sperm aspiration, and DD testis aspiration. Okay. I'll repeat methods of semen collection. One is masturbation, which is most commonly followed. Others is electroejaculation, vibrator therapy, surgical method like testicular sperm aspiration, microsurgical epididymal sperm aspiration, percutaneous epididymal sperm aspiration, reed testis aspiration. Instructions for semen sample collection. So one for that person will give a wide mounted container which is well packed. Okay, on that container on we'll write a name and date on the container and also on the lid. Okay, and if the person says that I am having abstinence more than 4 days, then don't take the sample. And the male person will wash their hands and penis with soap and water, and they'll dry with tissue paper. After masturbation, we'll collect the semen sample without using any oil or lubricants. Semen ejaculate right from the first drop they need to collect into the container. They should not touch the container or lid from inside because it contaminates. Okay, so close the container and hand over to the staff on duty. If any difficulty, if they're having retrograde ejaculation or any difficulty, then they should inform that this is the difficulty happening to the duty on doctor. So, what are the components of semen analysis? So, first thing is liquefaction. Okay, the semen which is collected will be very thick, viscous. It will become liquefied. Okay, so I told now we'll keep the semen sample in laminar flow hood. Okay, then liquefaction generally occurs in 50 to 30 minutes. Sometimes it takes about 1 hour in case of room temperature. Okay, so this is about liquefaction, and so if there is long time for liquefaction, like that it is more than 2 hours, that indicates that there are poor prostatic secretions because most of the liquefying enzymes are produced by prostate, and if the semen is becoming viscous at least 2 hours, that means liquefying enzymes are not there. That means there is poor prostatic response. Okay. Coming to that laboratory equipments and materials which are required. So once once that person gives semen sample to the lab, inside lab there should be laminar airflow hood. I told already. In that hood only we'll keep this container. Then we'll measure the pH meter, centrifuge machine, osmolality, osmometer. Coming to equipments, we need gloves, we need pipette, we need transfer pipettes, pH strips, glass slides, cover slips, and Meckeller's chamber or sperm meter. And we need 10 ml syringe, 20 ml syringe, Falcon's test tube, semen collecting containers, and 4 well nube dish. 4 well new dish. Okay. These equipments are required. Okay, people pipette for testing and transferring is another pipette, that is transfer pipette. Okay, coming to reagents, if they are stored in room temperature, we need oils and stains for vitality testing. If we are stored at a 4 degrees temperature, then flushing medium, culture medium, per coil of 45% and 90%, and sperm freezing media is required. Okay, room temperature, we need only oil and we need only stains. Okay, coming to color. So I told about liquefaction, it takes about 15 minutes or to 1 hour. If it is taking 2 hours, that means there is prostatic abnormality. Coming to color, color it is generally opalescent and homogeneous. If it is, it will be a red to yellow tinge depending upon the man's health. Coming to volume, volume generally according to WHO it is 1.5 ml, but it takes about 2 to 6 ml per ejaculate. Okay, very low volume such as congenital absence of congenital bilateral absence of vast difference. If the volume is very less, like 0.5 ml or 0.2 ml, there is congenital absence of vast difference, which is generally seen in, generally seen in which disease? Cystic fibrosis. Okay, it is generally seen in cystic fibrosis. So that's about volume. Coming to viscosity, generally it is viscous. Okay, and viscosity is measured by thread test. Like we'll catch the semen in 2 fingers and we'll stretch. I'm thinking, okay, not only 2 fingers, I think with slides also we can do. If there is string formation, if it is about less than 40 mm, that is normal viscosity. 40 to 60 mm, it is equivocal, and if it is more than 6 centimeter, if it is more than 6 centimeter, that is hyper. Okay, so viscosity is 6. Coming next point is 7. Is pH. pH normal range is 7 to 9. Okay, so measure the pH after volume and viscosity by touching the that empty emptied volume. See, we'll take a pipette now to take the semen sample. So that pipette end have some drops of semen. So that pipette is touched to these strips, and we'll see the color so that we can know the pH. Coming to motility, motility is first make 2 smears to air dry and use later. Okay, prepare 2 frosted glasslets and label. So you'll take two glasslets and we'll label. Okay, after labeling, we'll place 10 microliters. Okay, 10 micro that is I think 0.01 ml. I think okay. We'll keep that amount of cement onto the slide, and we'll take the second slide on top and smear across both surface like thick and thin smears. We'll smear and we'll allow it to air dry. Okay, that is one point. Second is place 10 microliters of semen on clean slide. We'll take a slide, we'll keep a semen, and we'll keep a cover slip. Okay. Allow to the sample to settle before going, but do not allow the sample to dry out. Okay. We'll use a contrast microscope. If te- if 10% of spermatozoa are involved in clumping, then motility is assessed on free spermatozoa. Okay, and aggregation is noted in appropriate section of the form. Then counting section. So we'll count the sperms. At least 200 sperms should be counted. Then we'll start counting the motile cells. Understood? In that slide, at least 200 sperms are counted. Then you start counting what is how are motile, which are motile. Okay. So it can be progressive motile, non-motile, non-progressive, or immotile. Okay. So pH range is C. Normal range is 7 to 9. Low is less than 7.2. Highest is more than 9. Indicates acute prostatitis. So I remember that high pH means prostatitis. How means? See, high means old age. So old age also will have prostatic hypertrophy. Na? In that way, high pH means acute prostatitis. Motility is different terms like R by L is rapid and linear progression, NP is non-progression, IM is immotile. Okay. Coming to degree of agglutination, if it is so what is agglutination? First we learn what is agglutination. Agglutination means clumping of the sperms into aggregates. Two types are the non-specific means it will aggregate with debris, leukocytes. Specific means aggregate with each other, like head fusing, head tail fusing. Site-specific agglutination specifies there is immunological cause and there is anti-sperm antibody. So site-specific. There is site-specific agglutination. That means there is some kind of antibodies, immunological cause. Okay, then we'll keep a cover slip now. So don't count the edges. Edges of the cover slip should be avoided. Coming to agglutination rating, see sperm I draw like seven sperm as 7. Okay. So 70, if it is more than 70, it is 3 plus, 30 to 70, it is 2 plus, 10 to 30 is 1 plus. If less than 10%, that is non-significant agglutination. So if there is less than 10% of agglutination, that is not that significant. Okay. Coming to morphology, at least 10% normal forms are there, that is good. Okay. We'll see a wet motility slide to make a rough approximation of head. So wet motility slide we'll see, and in that we'll see head, midpiece, tail, and all. Okay. Even cytoplasmic droplet defects can also be seen. Coming to debris, the white blood cell count, if it is more than 1 million per ml, and is a concern, and we should check that. Okay. So we'll count the number of large round cells, that is leukocytes, immature germ cells, and number of small dark cells as well. Okay. Uh, so even erythrocytes, cytoplasmic masses can be are measured. Okay. That's about debris. Debris also have some scoring. So debris is if it is 5 to 10% is 1 plus. If it is more than 10%, that is 2 plus. Okay. So less than 5% is normal. So I told less than 10% is normal in agglutination. So okay. So A is less than 10%, whereas B, debris, is less than 5%. Remember that. Coming to defects or morphological defects, head have different defects like large, small, tapering, pyriform, amorphous, vacuolated, and double head. Vaculate is important. Neck and midpiece is absent tail, bent, irregular midpiece, distended and thin. Tail, short tail, multiple tails, hairpin-like, broken, irregular width, and coiled. Coiled tails is important. Cytoplasmic droplet defects are more than one third of size of the head. If more than one third, if there is cytoplasmic defects, that means it is morphological defect. Okay, this is fifth edition WHO classification of semen analysis. So normal volume is 1.5 ml, total sperm count is 40 million, and pH is more than or equal to 7.2. Sperm concentration we already know 15. So 15 concentration we should I used to remember like this. Motility is 40. So go forward 40, forward 40. Then you have 32 is sorry, motility is 40 and forward is 32. Okay, forward progression, that is 32. Coming to morphology, if you have head oval and smooth, midpiece straight, tail single, and normal forms of 4% or greater, it is good. White blood cell count should be less than 1 million. Okay. So how to collect the semen analysis? How to collect the sample? No. After collecting the sample, which I already explained, you will check all the details of the patient and consent forms are checked. Then liquefy the sample at 37 degrees on a warmer for 20 to 30 minutes. If the sample is viscous, then again give a 30 minutes time. Okay. If still viscous, then antibodies are working. So we'll do a blood test for them. Okay. 2 ml sample is standard volume given by the patient. Measure the pH should be 7.2 to 7.4. Motility estimation is performed from the raw semen sample. Like you, how to see the motility. You will take 10 microliters of semen in Makeler's chamber. See, this is Makeler's chamber. Okay. So Makeler's counting chamber. Then you will see how to count motility. That is number of sperms moving forward and linear, sperm static, sperm moving in different direction. We also see the pus cells agglutination, that is site non-specific and specific. Morphology of the sperm is measured using pap smear. Pap staining. Abnormal sperm does not mean that they will produce abnormal offspring. So if the sperm has two heads, it also helpful to produce offspring, but there is no abnormality in the offspring. So how to perform semen analysis. So semen analysis is first you'll keep a drop of 10 microliters here, then spread on the entire surface of the disc. In that disc, we'll spread it, okay, and we'll cover it the cover glass, okay. Lift the chamber and place it on the change of microscope. So generally on the microscope you should not use 40x thing because the cover get damaged because of that, because it will touch the chamber. That's why 40x should not be used. We can use 20x. Take care not to press on the cover, and image is seen clearly when the tip of the objective is at least 1 mm above the surface. Then you can see the image. Okay. So it is recommended that use 20x objective or 10x eyepiece. 10 times X objective is not recommended because sperm will be seen small, and 40x will damage the cover glass. So what is the best objective for examining the sperms is 20x. Now coming to make a macular counting chamber, it's a simple device. It is used to see the accuracy and rapid sperm count, motility, morphology, and all. Chamber consists of two parts. Lower main part is metal base. If you see, this is the first part, lower part. This is the first part, that is metal base. Okay, it has a flat glass. So if you see, this is a flat glass when the sample is placed. Around the disc, there is four pins. Their tips are 10 microns above the surface of the disc. So you have four pins, which is 10 microns above. Upper part is cover glass encircled with metal. So if you have a cover glass, in that there is a ring. There is encircled with metal ring. At the center of its lower part, there is 1 square grid subdivided into 1000 squares. So it sorry 100 squares. This is divided into 100 squares. Each square is about 0.1 mm. When the cover slide placed on the four tips, the space between bounded in the row of 10 squares is exactly 1 millionth of ml. Understood? So the space in a row of 10 squares. So if you see, these are all 100 squares. Now, if you take 10 squares, if you take 10 squares, that is 1 millionth of ml. Therefore, the number of sperms heading in 10 squares indicate their so in these 10 squares, how many sperms are going? That indicates the number of sperms. For example, if the number of sperms going in this 10 square are about 40. That means the total number of sperms is 40 million per ml. You understood? So in this, what I'm telling is, so total sperm count is 40 million per ejaculate. They're saying how they're counting means in that 100 square macular chamber, in 10 square they will count the sperms. Okay, if it is 40, that means the total sperm count is good. Okay, that way. That's it. Okay, that will be number of sperms. If the count is 40, once there is 40, that means it is normal. Okay, that's it. Coming to accessories, we have a cleaning brush, we have a tissue paper, chamber grip. This device should be placed in the stage of microscope during sperm analysis. It grips the chamber tightly and smooths shifting of the chamber on the stage. When the sperm analysis is completed, hold the grip and slide the chamber out. You will hold the grip and chamber is removed. Slide the chamber again it's a grip for new sperm analysis. So grip is there, one grip is there. After that, we for every sample we'll change that. Okay. How to prepare the chamber? Before placing the semen sample on the disc, make certain that absolutely it is clean and no dust and all. Okay. For this purpose, we will use a lens paper for wiping the surfaces. So we'll place a cover slide and looking for color fringes at four contact points. Okay. Sperm count. I already told sperm count. We'll place a small drop on chamber, and after sperms are brought into focus, then locate the grid in center of the view area. Okay, and we'll see in this way. If you see this, there are totally 1 2 3 4 5 6 7 8 9 10 10 small squares. In this you see heads of the sperms, you'll count heads. So 1 2 3 4 5 6 7 8 9 10 11. So there are 11 million sperms in that way. Okay, in that way. So during this search, you have an opportunity to observe the following: whether the sperms are spread uniformly or not, and sperm seen in one focal plane or not. We can see this. Coming to motility evaluation. So motility evaluation within 3 to 5 minutes after application of the sample is done, because the 3 to 5 minutes only you should observe, because the sperms have tendency to migrate to the periphery. So non-motile sperms are counted in 10 squares, and count the motile sperm in the same area and estimate the grade of motility. Repeat this procedure in another area of grid as well as from another 3 to 4 drops. And you see, again we'll repeat this motility on another 3 to 4 drops and calculate the average. Okay, in that way. Coming to morphology we'll use wet unstained sample containing immobilized sperms. Okay, after counting to 200 sperms, we'll see the morphology by staining pap staining method or differential quick method. Okay, so special cases, if after placing in the grid, if there are bubbles, then drop is replaced by another one. Okay, unless bubbles are too small to interfere the analysis. In this case, the drop should be replaced with properly mixed new specimen. How to clean and reuse? You'll dip the chamber na, you should not rinse or soak in the water. Okay, dip a brush in the water, then use that brush and just swipe the chamber. Okay, or in water, or we can use non-corrosive antiseptic solution as well. So both sides of the glass are cleaned. Then we'll squeeze the brush and sponge off the remaining water. Finally, dry the surface with lint-free paper we'll use. So this is laminar hood and workstation. If you see, it is laminar hood. These are laminar hoods. Okay. Once the sample is there, we'll keep in this hood, petri dishes. And you have round bottom tube of 14 ml gradation. Um, these are pipples. And I told one of the equipment is Falcon 60 petri dish. Okay, central well dish and 4 well dish of nuke, which I told initially. These are also used. So, thing is, thing is, yeah. So after cleaning of the macros chamber, do not touch the tips. Chamber is now ready to reuse. Uh, Once you focus the microscope, then no need of focusing each and every time. Just change the chamber, like change the slide from the chamber and keep a new another slide. Okay. This is about sperm. Next video, I'll tell about ovum pickup followed by embryo transfer. Okay. Thank you.